So the symptoms of ankylosing spondylitis is significant morning stiffness. This is where patients will wake up, they will have stiffness for hours and hours in the morning that is better with activity. They also get inflammatory low back pain. So again, this is pain in the lower back that only gets relieved when the patient kind of gets up and moves around and then tries to go back to sleep. These patients can get fusion of the spine in different parts, meaning that some of them will just get attacking of the ropes that connect the bones in the lower part of the spine. Sometimes they can go upwards to the middle of the spine, and then sometimes it can go all the way up towards the neck. So as a result, these patients have a very hard time bending over and touching their toes, kind of bending that lower part of the back. They have a hard time taking a deep breath in sometimes. They can't stand up straight against the back of a wall or the back of a door. And sometimes they can't even turn their neck, like when they're trying to drive and try and check their blind spot, they actually have to move their whole chest to do it effectively. These patients can get a lot of soreness and tenderness at the ropes that connect the bones to the bones, called the ligaments, or the ropes that connect the muscle to the bones, called the tendons. And this can also lead to dactylitis, where the whole finger or the whole toe becomes swollen, and you can see this on exam, like when they have that whole swollen finger or toe, it almost looks broken. These patients can also get what is called extra-articular disease, which means disease that is not in the joint but is in other parts of the body, an autoimmune response. And so these patients can get inflammation in the water behind the whites of the eye. This also is a disease that can run in families, so they could have family members that are affected as well. So as far as who gets ankylosing spondylitis, well, it is a younger patient population. It's about 20s to 30s is when it will first start up, but it's still a very rare disease. So if you take the example of how many people do I need in a room for even one person to have this, I would need over 10,000 people in a room for one person to have this. It is more common in whites, and men tend to get more of the spine disease rather than the women who get more inflammation. It can run in families, as I talked about before, and actually it has a genetic marker, but the genetic marker is kind of something that only works one way, which means